Hi there, I'm Brian Melville, the Director of Education for Elite Ambulance. I'm here today to answer some frequently asked questions when it comes to emergency medical responders. Fantastic question. So EMR is an abbreviation for Emergency Medical Responder. EMRs have classically been used in rural areas where they're the first people to arrive on a scene when somebody's having a medical or injury type emergency. And they render first assessment. They're the first contact with the patient. So basic assessment, start some treatment while we're waiting for the ambulance to get to the scene. We've recently changed that, where now EMRs are not just functioning on the rural side of things. EMRs are now being used on the transport side of the house, where they're paired up with an EMT. And EMRs are a huge force multiplier out there for a short-staffed EMS field. This is a very popular question. So EMRs are taught to basically at a survey level. And what I mean by a survey level is it's the wading your feet into the waters of medicine, of emergency medicine, in the aspect of you are taught the basics of human anatomy, how the body functions, and you're taught how to render those first line assessments, checking vital signs, and begin setting up treatments so that the EMT can go further. So EMTs are trained to a much deeper level as far as human anatomy goes, treatment goes. So certain pieces of more advanced equipment, medications that the EMT is allowed to administer, and you'll be helping the EMT render those treatments. The requirements for entering an EMR class are you have to be 18 years of age with a high school diploma or GED equivalency. Also, you have to have 2 years of a clean driving record and be able to pass a criminal background check. As far as the cost of the class for EMR is $200. However, if you decide to pursue the career track of continuing on with your education in emergency medical services, you want to go on to become an EMT, we will apply that $200 towards your tuition for EMT class. I get asked this quite a bit, and the advantage of becoming an EMR before you become an EMT is it's multifaceted. So we'll just talk about a couple branches of that. The first branch I'd like to talk about is, first of all, if you're new to the medical field and you just want to get a feel for what it's like, what do emergency medical responders do, first responders do? It's a 9-day, 2 to 3 week class where it's intense learning, but by the end of EMR class, you're going to have a real feel for what emergency medical services are all about, and if that's something that you want to pursue further. The second branch of that, the second and third branch, I can actually say, is that you'll be out there in the field already working with an EMT while you're going through your EMT education. So everything that you're seeing in your textbooks, you're putting it in real time on the days where you're working and you're not in class. You'll also have a really, really solid foundation in emergency medical services, and it provides an excellent foundation for what you're going to learn in EMT as you go deeper into that material about the human body. We have multiple classes going on all the time here. Our classes for EMR, we host classes in our Chicago location, our Schiller Park location, our main headquarters in Orland Park, Hickory Hills, Naperville, and Elgin. So the class is about 9 days, 9 to 10 days depending on the class. So you're looking at either a Monday through Friday class for 2 weeks, or we break it up into Mondays, Wednesdays, and Fridays so that you can work your job. You don't have to take 2 straight weeks off of your current job in order to get the education that you need. We don't want you quitting your job as you go through this education. We want you to dabble your feet into it, wade into that water. That's what I like to do as an instructor, is wade you into that water of education. So expect 2 to 3 weeks dedicated to this program, and because the program is very short, it's intense. Attendance is mandatory. You don't want to miss any of this material and find yourself behind. Oh, as far as when you can be on an ambulance. Once you complete the course, we'll have you walk right into a job with us once you complete the course. Consider your EMR course as a 9-day interview, as your instructor evaluates your abilities. And upon graduation of your program, while we're waiting for your license to get processed by the state, we'll put you up as a third rider so that you are gaining weeks of experience before we put you out there working one-on-one with an EMT. So EMS is a winding path of careers. So in EMS, EMR is your starting block. That's the introductory level. If you decide that you get bit by the EMS bug, like all of us that got into this did, you can then progress on to become an EMT. EMT class is, while you spent 9 days learning how to become an EMR and getting that survey level, introduction level, EMT class you can expect to dedicate a good 4 months to, on the average, of a few hours a day, a few days a week of class time. If you still want to stick with EMS as you become an EMT, a natural progression is to move on to become a paramedic. Now, if you want to discuss differences between EMT and paramedic, that's probably a whole other video that we can get into, other than to say that you have a host of different procedures, medications, abilities that you have that you can render to the patient for assisting the sick and injured. Paramedics that, once you work your way from EMT to paramedic, expect to dedicate about a year of your life to paramedic school. If this was easy, everybody could do it, all right? Everybody would do it. Once you succeed at becoming a paramedic, where can that take you? So we have some people that stay working on ambulances with private organizations, in industrial settings, in working events, and this is for EMTs and EMRs as well, working events such as concerts, for example. Also, you have some paramedics that decide to go onto the municipal track and they want to join their local fire department. So they'll go join their fire department. Some paramedics will progress on to critical care, where you are taking care of the sickest of the sick patients. So critical care will operate as a team with even further advanced equipment, more medications at their disposal, and these are some very, very high-speed EMS providers. And some of them will even progress to working on aeromedical, so helicopters, planes, things of that nature. If you're interested in checking out our classes, dates, times, locations, feel free to check us out on our website, EMT-B.com. Click the Education tab, and you'll be able to navigate through our EMR classes and EMT classes. I want to thank you for taking the time to check out this video with us today. If you have any further questions, please feel free to reach out to us at education@EliteAMB.com.